Good evening and welcome to the webinar presented by the National Cutting Horse Association relative to the medication rules and guidelines. I'm Dr. Jerry Black. I am chairman of the medication subcommittee of the Horse and Cattle Welfare Committee for the National Cutting Horse Association. I am from Colorado State University, and on behalf of the executive committee and the Welfare Committee of National Cutting Horse Association, we certainly want to welcome you to this webinar, and we hope that the information we provide will be beneficial to you. Next slide, please. I want to remind everyone exactly why this policy is going into place, and I will read the next slide as you read along. The National Cutting Horse Association's medication rules and guidelines have been adopted to protect and prolong the health and welfare of the great horses exhibited in the cutting events. The NCHA believes that the safety of horses is a priority. Next slide, please. I want to spend just a little bit of time discussing with you the various types of medication that are defined in the policy. And keep in mind that the entire policy, as well as the guidelines, are now printed in the NCHA rulebook on pages 60 through 71. And we would like certainly for anyone that has not read those already to look into your rulebook and see them. They are also on the NCHA website, and if you look down the right side under the menu bar there, under medication rules, you not only can pick up the rules and the guidelines, but additional significant information on a document called the fact sheet, as well as in a summary of allowable amounts of medication. As in the rule book, the first classification of medications that is discussed is prohibited drugs and medications. And these may not be administered internally or externally to any horse within 24 hours or longer of that horse showing at an NCHA-produced event. No significant amount of drug or its metabolites should be found in a test sample. And these would certainly include Class 1 and Class 2 substances, such as narcotics. It certainly would include stimulants, depressants, or tranquilizers, or any other type of psychotropic agents. The exception, which we'll discuss in more detail, is acepromazine at very defined and allowable limits. And certainly anything that might be considered a masking agent for detection of other drugs in the sample. I do want to make one point clear here. This medication policy is going to be basically in place and enforced at NCHA-produced events only to begin this medication policy. So that will be the Triple Crown events in Fort Worth, as well as the Eastern and Western National Championships. Next slide, please. The permitted medications are the medications that the committee has deemed to be therapeutic in nature, and as long as they're not in excessive amounts in the system, are permitted medications with no medication report required. So these are medications you can use on a regular basis. You don't have to notify anyone about it, and they're typically the drugs that you would use on your horses to benefit them during competition. So non-steroidal anti-inflammatory drugs that Dr. Stanley will talk about, we commonly call NSAIDs or NSAIDs. They're considered a rule violation if the test sample contains significant levels of more than one of the permitted systemic non-steroidals. And so, as Dr. Stanley will discuss with you, you need to select a medication that you want to show on, and you want, if you have a secondary medication that's being used prior to competition, you want to make sure that you withdraw that secondary medication, the second non-steroidal, if you will, in enough time that it clears the sample at the time of competition. The exception, of course, is Surpass, that Dr. Stanley will discuss. It is a topical cream. It has significant anti-inflammatory properties and can be used, because it is not being used systemically, can be used with one other non-steroidal, i.e., for example, you could use Bute and Surpass at the same time for competition. Now, all of these non-steroidals must be given as therapeutic medications at therapeutic levels. And the guidelines and fact sheets give you the details necessary to have you understand what those levels are. Basically, they are levels that the drug manufacturers recommend to achieve a full therapeutic effect for each of these non-steroidal anti-inflammatories and some of the other permitted medications as well. In the non-steroidal anti-inflammatory group, they must be given 6 hours or more prior to competition. Now, this is quite different than all other medication policies that are out there for the equine industry now. We are allowing these at 6 hours so that they all will have maximum therapeutic effect, whereas all other organizations, to my knowledge at this point in time, are using 12-hour cutoff times or longer. Next slide, please. There are 7 non-steroidal anti-inflammatories that Dr. Stanley will discuss with you. I just keep reminding you that no medication report is required for these. There are 6 that are considered systemic, and then the topical cream Surpass is allowed as well. The other medications that are permitted are not in the non-steroidal anti-inflammatory category. But these other permitted medications that are clearly listed in the rules and guidelines require no medication report either. And these other medications can still be used with the one non-steroidal anti-inflammatory that you have selected. More than one of these other permitted medications can be used at the same time. For example, you could use dexamethasone and Robaxin at the same time and use it in conjunction with one non-steroidal anti-inflammatory drug. Next slide, please. Here are the lists, and these are clearly stated in the rules and guidelines and fact sheets as well. They include dexamethasone, which is a pure anti-inflammatory, a cortisone, if you will, Gastrogard or omeprazole, which is an anti-ulcer medication, Robaxin or methocarbamol, which is a skeletal muscle relaxant, Lasix or Salix, which could be used for bleeders. It is a pure diuretic, not used as much in our competitions as some of the other speed events. Isoxaprine hydrochloride, which is commonly used for chronic heel pain and similar conditions. Regimen, of course, which is a progesterone-like substance which is used on mares for control of estrus. Acetazolamide is rarely used in cutting horses, but it is a drug specifically used for HYPP in horses. Next slide, please. Other permitted medications is acepromazine. As you know, acepromazine is a tranquilizer. With acepromazine, the medication report must be submitted. It must be a prescription or administered by a veterinarian. And certainly when you fill out the medication report, you want to have a standard prescription form from your veterinarian that says that he has prescribed this drug or other drugs. He does not have to sign off on the medication report itself. He simply has to give you a prescription, which could be for more than one event, but a copy of that prescription must be attached to the medication report. Now, the written prescription, as I mentioned, needs to be with the medication report unless the veterinarian fills out the medication report because he has administered the drug. Now, the time frame, because of how long acepromazine is effective as a tranquilizer, is it must be given 1 hour or longer prior to competition. And the maximum dose for the horse is a half or 0.5 milligrams or less per 100 pounds. So the dose for a 1,000-pound horse would be 5 milligrams in its usual formulation, or 1/2 a cc for a 1,000-pound horse. Next slide, please. Conditionally permitted therapeutic medications are all other therapeutic medications that aren't on the prohibited substance list that are not included in the therapeutic drugs that are allowable. These could be antibiotics, it could be vintapolamine or clenbuterol, for example. They must be given 24 hours before competition. Medication report must be filed with the show, and the licensed veterinarian must either administer them or prescribe them as therapeutic medication. I do want to make a note about antibiotics. They're not considered to be performance-modifying substances, and so once that you have declared that your horse is on antibiotics and is prescribed by a veterinarian, you do not have to continually put a new medication report in place, nor will those medications be excluded from 24 hours prior to competition. In other words, for antibiotics, because it is not a performance-modifying drug, once you declare that you're using them, you could use an antibiotic, for example, SMZs or one of those sulfa antibiotics. You could use those on the day of performance. Next slide, please. Emergency medication is medication that needs to be given in the 24-hour time frame prior to competition. These all have to be therapeutic medications. They need to be given by a licensed veterinarian, and you need to report this prior to giving it to show management. And they have the right to either witness or designate a representative to witness the event. And a medication report needs to be filed for this. So the typical use of this would be for injury or minor lacerations. It certainly could be colic. Perhaps you've already administered one nonsteroidal anti-inflammatory, but your horse has a mild gas colic, and your veterinarian wishes to administer Banamine, which is a very appropriate drug. That would be permissible to use. Here we have a copy of the medication report form that will be filed with show management. You can see that it is it's a very simple form to fill out, mainly the name of the horse, the reason that you're giving it with the diagnosis, the name of the medication you're giving, how much you're giving. You need to know the concentration or strength because it varies in the product. How you're going to give it, and the date and time approximately that you are giving it. And it has to be signed by either a veterinarian, an owner of the horse, or an agent of the horse, primarily the trainer. So this will be available in the show offices. You can pick these up and take them back and fill them out appropriately with the help of your veterinarian, or have your veterinarian fill them out and take them back to show management. Keep in mind, if the veterinarian is not on the premises and he has prescribed the medication as a therapeutic agent, you would want a copy of that prescription that would be attached to this medication form when you submit it to show management. Next slide, please. Here are some typical questions that have been asked, and a lot of these were put together by Ms. Lindy Birch, who has certainly been diligent in working with the Welfare Committee on behalf of NCHA and development of this medication policy. So Lindy has been asked a lot of these questions at events and such, and we've tried to put together a few of them, and I know there will be more that we will try to answer for you, but a few of them that may help you understand the policy better. First question, can I use dexamethasone and Surpass? Yes, all permitted medications and used at appropriate therapeutic levels do not require reporting. Keep in mind, for example, though, that Bute and Surpass should not be used earlier or prior to 6 hours. 6 hours or longer, dexamethasone typically would be used at 12 hours at full dose, so you need to check your rules and guidelines on that. Can I use Regimate on stallions? Sex is not considered in testing, so if that is something that your veterinarian has prescribed for you, then it can be used. It is a permitted medication, does not require a report. Can Equiox be used prior to another nonsteroidal? Yes, but the withdrawal time is extended due to its extended therapeutic level and half-life that Dr. Stanley will talk about. So the withdrawal time potentially is longer and probably not the best medication to use as a secondary nonsteroidal because of its long period of time that is effective. However, we are finding, and I know that many of you out there are using it, Equiox is an excellent medication to use during the entire competition. It's safe. It has less side effects than many of the other nonsteroidal anti-inflammatories. It's very effective in the fact that you can maintain high therapeutic levels and not have the peaks and valleys of other shorter-acting nonsteroidals over the course of an event. It's often begun 2 to 3 days prior to competition just because it takes a little bit longer for this drug to reach its full effect, but we typically have found, at least in our dealings with Equiox, or Firocoxib, if you will, that by the third day you're getting basically the same effects that you would get out of phenylbutazone, and because of its extended duration of action, it's an easy medication to give in the evenings, once a day, and not worry about chasing the time frame of the 6-hour limit. Next slide, please. Can I use Ventolin or clenbuterol? Yes, clenbuterol is not listed at this time as a prohibited drug, although it is in many drug and medication policies by other equestrian events. We are allowing a use 24 hours prior to competition at therapeutic levels and prescribed by your veterinarian. The problem with clenbuterol is that it does have a significant anabolic or performance-enhancing effect. As many of you know, this is a medication that's been in the press a lot lately in human athletes, from baseball to cycling, etc., because of its use for performance enhancement. It certainly is therapeutic for chronic or lower airway disease. We understand that, and that's why we are not prohibiting the drug. And this medication will be discussed further at the upcoming Welfare and Medication Committee meetings at the convention. Next slide, please. I hear that there are nonsteroidals and psychotropic drugs that do not test. Is this true? There's certainly many nonsteroidal anti-inflammatory agents that are out there. Most of them that are not listed here are obviously on the human side. But I do remind you that those medications are not approved in any equine organization that does medication testing. We're in a little different situation here where we are using one of the finest labs in the country, if not in the world. And I would just caution you that it is likely that the lab would pick up some drug here that could cause you to have significant penalties implied to you based upon prohibited substance found in the test sample. Next question, please. Testing in responsible parties. The horses in NCHA-produced shows will be randomly tested. And we do have a bit of misinformation that is out there right now, because during some of our 2011 educational testing and looking at what was being used, we did specifically test champions, reserve champions in some events. That is not the case in the drug policy. You can read it in the rule book, that the show itself will be randomly tested. The finals will be randomly tested as well. Who are the responsible parties? Certainly the owners of the horse are the responsible parties, so they would be the main responsible parties in amateur and non-professional events. And in the open division, the trainer or the rider will be the primary responsible persons as the agent of the owners, since they have primary care and custody of the horse. For any more information on penalty and enforcement procedures, I certainly suggest to you that you read carefully the medication rules in the rule book or on the website, and we will include some more discussion of that phase of the policy during the convention. Next slide, please. Next, we will have Dr. Scott Stanley from UC Davis, who is head of the testing lab there, speak to us about some of the more specifics of the medication policy, and Dr. Mike Martin will follow Dr. Stanley talking about the testing procedures themselves. I want to thank you for my portion of the webinar, and we look forward to answering any questions that you may have in the near future. Dr. Stanley, could you begin your presentation?
Thank you, Dr. Black. I appreciate the opportunity to present this information today for the National Cutting Horse Association. I'm Scott Stanley from UC Davis. I work with Dr. Heather Knicha, veterinary equine pharmacologist, and we prepared a little bit of information on the drug testing program done at UC Davis for the National Cutting Horse Association. The first slide that I have is just to give a little bit more background on the laboratory. Our drug testing program is certainly a biggest part of our program at UC Davis, but we also do a lot of research into pharmacokinetics. We look at new drug models to determine elimination times, and we investigate and identify new drug conformations, as well as do some proteomic analysis for biological, biopharmaceutical drugs like erythropoietin and growth hormone. Cutting Horse Association industry asked us to get involved with the drug testing program in order to help them establish some industry integrity. They already have a long history of that, and the industry reputation of high-profile events, as well as the horses and the horsemen's reputation, are very important to the Cutting Horse Association. We also understand through our long history of drug testing for shows and for race events that the horses and horsemen's disqualifications, potential fines, and suspensions can be very detrimental. So we want to make sure that we have a strong program that has a good laboratory reputation, as well as good regulation, good rules behind it. Next slide. What we have now is what are we looking for in the National Cutting Horse Association samples? And we have put together or assisted in the put together of the rules for that program. So we have specific drugs that are allowed, and we also have permitted medications. So the combination would be is we look for prohibited substances, ones that are not specifically allowed, and then we regulate those drugs that are permitted, and we do that on a time basis, either 6-hour, 12-hour, 24, 48-hour medications or how we look at them. And we have a lot of regulations looking at the 6-hour regulations for non-steroidal anti-inflammatories and other therapeutic drug models. We also have conditions for conditional therapeutics, and then for emergency medications as well. Next slide, please. The FDA has approved nonsteroidal anti-inflammatory drugs for use in the horse. So principally that's what the National Cutting Horse Association, as well as other show events, have regulated and considered over several years. Horse-approved nonsteroidal anti-inflammatories include phenylbutazone, flunixin, which is Banamine, ketoprofen, diclofenac, ferritoxib, naproxen, and also Meclofenamic acid. Those are all 7 approved nonsteroidal anti-inflammatories that are used and have a lot of good information about withdrawal and therapeutic applications for those drugs. The other approved nonsteroidal anti-inflammatories for use in other animal species have been applied for horses, but we don't have good recommendations for withdrawal time and therapeutic applications. So those are generally prohibited to be present in the horse during competitions. Next slide, please. Nonsteroidal anti-inflammatory drugs, most prominently and most significantly throughout the last several decades, has been phenylbutazone. It has a long history. We have a lot of good information. One of the practitioners presenting at the AAP last year actually has a lot of experience with phenylbutazone, and he considers it a very safe drug to be used and generally very effective in all the horses. Several practitioners have expressed that to me, that they're very effective and they can be used very safely. So the new COX-2, the newer nonsteroidal anti-inflammatories that are specific for cyclooxygenase 2 enzyme, have been approved for use in the horse, but we generally have a lot more information about some of the older ones like phenylbutazone. To start with that, what the National Cutting Horse Association, their veterinary advisors, and the AAP generally recommend is a 2-gram dose for that drug. It's approved, so that use is approved by the FDA and generally has a very good outcome. There's multiple generic forms, which means it's relatively readily available and inexpensive. It also can be given by multiple routes of administration, so it has a good history of efficacy within the horses that are using that for performance purposes. Next slide, please. Flunixin meglumine, or Banamine, is another nonsteroidal anti-inflammatory that has a lot of general use. 1.1 milligram per kilogram is the recommended dose for most therapeutic applications. The generic products are available, so that become less expensive, and it's been approved by the FDA for a number of years. It's also available in both oral and injectable forms, so it's readily usable in a lot of different applications. That's flunixin or Banamine. The next slide, please. The one thing that a lot of practitioners and horsemen may not understand is that these drugs, phenylbutazone and flunixin, have much different clearances, and that's how quickly the drug is eliminated from the horse's system. With flunixin, it has a short half-life. This slide here shows the half-life of 2 different drugs, the top graph being phenylbutazone and the bottom one being flunixin. Flunixin has a shorter half-life. It can still be administered daily, but it clears much more quickly. So there are a lot of folks that have used traditionally doses of flunixin as a secondary drug because it clears more quickly, and then they can compete on phenylbutazone with a withdrawal of 48 hours. Having 2 nonsteroidals is a very effective way to use flunixin, withdrawing that and competing on phenylbutazone. Next slide, please. Another nonsteroidal anti-inflammatory that's been approved for a number of years is ketoprofen. Ketoprofen is generally used as a 2.2 milligram per kilogram dose. It's an FDA-approved product for use in a horse, available only as an injectable, but it can be administered IV or IM. Peak effect for that drug is generally about 8 to 12 hours, and it also, like flunixin, has a short half-life, meaning that this drug is also cleared relatively quickly, so it can be used as a secondary nonsteroidal anti-inflammatory, but still cleared from competition. So using this drug, ketoprofen or flunixin, is a very effective way to be permitted to use 2 nonsteroidals, but still have the second one cleared from the horse's system during competition. Next slide, please. Ferritoxib is relatively new. It's a cyclooxygenase 2 selective nonsteroidal anti-inflammatory. It's marketed as Equiox. It's a 0.1 milligram per kilogram dose. It is approved by the FDA. It's now available not only as an oral but as an injectable form, but it has a much longer half-life. And that half-life is what leads us to our detectability of that drug. So this is a drug that, even more so than phenylbutazone, will stick around in a horse's system much longer. If people have used this drug, it is something that they would probably need anywhere from a 5 to 7 day withdrawal, depending on exactly how long they used it, if they use it as a second non-steroidal anti-inflammatory. Diclofenac sodium, the next slide, is Surpass. It's also an FDA-approved topical cream. It does not have a well-defined half-life, and it's typically used in combination with other non-steroidal anti-inflammatories. National Cutting Horse Association and their veterinary panel has recommended that this drug not be regulated the same as other non-steroidal anti-inflammatories, so that this can be used concurrently with a drug like phenylbutazone or flunixin, and this is typically put directly on the site of action. Next slide, please. Meclofenamic acid, or Arquil, is another approved non-steroidal anti-inflammatory. It has a slower onset of action, which means that it takes longer for it to have its peak effect. It's used orally and has very good bioavailability, but it has a slow onset of action, which typically means that it would take longer for the horse to have effect, or its anti-inflammatory effects. This drug is also one of the ones that clears more slowly, meaning it has a longer half-life. Generally can be used very effectively, but needs to be used very cautiously when coming into competition if two non-steroidal anti-inflammatory drugs are being used. The next slide, please. Naproxen, or naproxen sodium, is often referred to as a drug that has come around more frequently now that the coxibs are less utilized in human medicine. Equiproxin is a drug that's given at 4.0 milligrams per pound. It's approved for use by the FDA. It's available as an oral product. There are several other human products that are used in place of equiproxin when it's not available. Drugs like Aleve have naproxen in them. Unfortunately, it is typically not recommended to use human medications on horses because the absorption can be slightly different. So most of the recommendations that we have as far as the threshold and clearance of the medication is due to the original FDA-approved equine product. So those that might be using a human product over the counter may run into withdrawal time recommendation problems. This has a long half-life, so this drug can be around for many days after the drug's withdrawn if the dosing is over a period of time. Next slide, please. Regarding this drug, the non-steroidals that I provided as well as other drugs, what we try and do with our withdrawal recommendations is we look at experimental data, and that's typically on a set of animals, either as few as 8 and as many as 20, to make a recommendation so that we can have the drug withdrawn before competition to avoid a violation. Experimentally, we do that whenever possible. We have that for the 7 approved non-steroidals. We have that for several of the other therapeutic drugs that we have listed on the National Cutting Horse Association website. The withdrawal information for drugs like omeprazole, for also the methylcarbamol, and other medications are experimentally established in a format like this. We use a statistically derived factual information on experimentation and then the detection time, or the last time that the drug can be detected, in order to establish the withdrawal guideline information. Next slide, please. Factors that affect the withdrawal times, however, are extremely variable, and one needs to take into consideration when you're using or selecting a non-steroidal anti-inflammatory or any medication, the dose utilized. The dose is paramount and the most vital component. So if you're talking to the regulators, if you're talking to your veterinary practitioner, if you're talking to someone at the show about the withdrawal of a medication, please provide as much information about the dose and the route of administration as possible. The frequency of administration, is it once a day, a twice a day, or even a 3 times a day drug? And then the preparation. Things that the way the drug is formulated. In some cases, like glucocorticoids have a C21 ester. The ester off that drug can help the drug be absorbed for a longer period of time and eliminated at a slow rate, or in some cases to be excreted very rapidly. So the drug formulation or preparation is often a factor. Next slide, please. Other information about the drug solubility, the type of tests are done, drug-drug interactions, and animal variability are also factored into the withdrawal recommendations or guidelines provided. Those are not something that are quite under control of the veterinarian or the horseman involved with handling and selecting the therapeutic drug, but they are factored in for the National Cutting Horse Association recommendations that have been provided. The next slide, please. The withdrawal guidelines that we've laid out are generally divided by a period of time, a 6-hour window, a 12-hour, 48, and 72-hour windows that are shown here. The event day medications are intended to be prohibited at a 6-hour point prior to competition, meaning that those medications can be used not closer than 6 hours of the competition. There's also several medications that are looked at from a 12-hour time point, and then 48 and 72 recommendations are also provided in the National Cutting Horse Withdrawal Guideline information. Next slide, please. Generally, the 6 non-steroidal anti-inflammatory drugs that we have withdraw 6-hour period are the flunixin, the phenylbutazone, ketoprofen, naproxen, Meclofenamic acid, and ferrocoxib. The one of the 7 approved that's not listed here is the diclofenac. The diclofenac cream is intended to be used concurrently, so that's not listed here on the 6-hour show date competitive drugs that we're showing. The next slide, please. In addition to that, the recommendation for methylcarbamol, Robaxin, and dexamethasone is a 12-hour showtime withdrawal. So that means that those medications should not be or were not recommended to be administered within 12 hours of competition. The next slide is the 48-hour showtime period. This is for eventers that want to compete or utilize a different non-steroidal anti-inflammatory and withdraw that. We generally recommend that phenylbutazone, flunixin, or ketoprofen be utilized, as that is one that's typically competing on or withdrawn prior to competition. The reason that we recommend those 3 drugs is we have the best information at the 48-hour time period for withdrawal of those drugs. We don't have confidence that with ferrocoxib or in some cases meclofenamic acid or naproxen that we can clear those drugs within the 48-hour window and not have a violation. These 3 drugs, phenylbutazone, flunixin, and ketoprofen, are quite safe to withdraw at a 48-hour period of time and not have a violation. The next slide, please. In addition to those, other medications that are approved for use or permitted that Dr. Black talked about previously, chloroprofen, detomidine, guanabens, ketoprofen, and romifidine are drugs that are recommended to be withdrawn at least 72 hours prior to competition for these events. That would comply with all the medication obligations that a practitioner and an eventer would have coming into one of these Cutting Horse Association events. Next slide. That was all the prepared material that I have. I believe that Dr. Mike Martin will be speaking next and giving some detailed information about the collection and the chain of custody of the samples at show events.
Thank you, Dr. Stanley. Greetings from Texas A&M. This is Dr. Mike Martin. My responsibility on this webinar today is drug sample collection for National Cutting Horse Association events. Next slide, please. This section of the webinar is dedicated to 4 main topics: sample collection, sample sealing, that includes labeling. Third would be the witness form, and the fourth would be handling of sealed samples. This process is very similar and in many aspects exactly like the drug testing protocols used for many years in other disciplines and associations. An example would be the AQHA, the National Reining Cow Horse Association, the United States Equestrian Federation, and other breeds and disciplines. Next slide, please. Under sample collection, obviously we want to know who will be doing the sampling. There will be a veterinarian employed by the National Cutting Horse Association to directly either obtain samples or supervise the taking of samples by a technician. All equipment will be provided by the Dr. Stanley from his lab, who just gave you his presentation at UC Davis. That equipment would be shipped to either the veterinarian or to the event prior to the show dates. Pretty standard in testing protocols is the use of a testing stall. This is a very efficient way to drug test horses at an event. It's a little better way to have your supplies and equipment available and keep things in a nice, orderly, clean fashion. These stalls will be bedded and so forth for sample collection for the animal. Next slide. Collection sample, it should be fairly straightforward. Either blood or urine will be collected from the horse. If blood is the sample that is used, we will take 2 tubes of blood from that horse drawn from the jugular vein, or a naturally voided urine sample. This sample may be, taken by a technician. Next slide, please. Sample sealing. It's a very important part of the chain of custody here when we're talking about protocols with drug samples. The sample sealing, the California lab uses a barcode system with an accompanying number, and hopefully you can read that across that label on that urine cup there. There is a blank for the event. Also another blank there you can see for the date the sample was taken. There is a section of that label that requires either initial or signature of the person collecting the sample, collecting and or sealing the sample, and then also in the bottom right-hand corner is a blank for the witness to the sealing of that sample. The lower photograph there is of a sealed urine sample, kind of from a side view, so you can see the barcode and the seal going around that urine cup. Next slide, please. This slide shows us just a sealed blood tube. There will be 2 of these sealed together to send to the lab. The barcode and accompanying number, basically it's the same type of seal, same type of label that will be used on either the blood or urine. It is my understanding that the NCHA will only require either a blood sample or a urine sample from an individual horse. Next slide, please. The witness form is very important here. There will need to be somebody, trainer, owner, designated witness, 18 years of age or older, that will accompany the horse to the testing stall to verify that the sample comes from that, the individual horse that's brought for testing. The witness needs to, examine and look at the barcode number that will be transferred to the medication testing form. And let's see, let's go to the next slide. Here's an example of that medication testing form. As you can see, pretty standard information, date, show, name of the horse, and so forth. The name of the person accompanying the horse. Time of testing should probably be the person that will be the witness. It could be a different individual. And in the lower left-hand corner will require signature and a printed, name there, as well as a veterinarian signature. This form, in my understanding, is going to be there will be a copy of this form, so it'll be in a duplicate, so that whoever, either owner or witness, would like to have a copy of that form with the numbers and so forth on it, sample numbers, is able to take that and keep that for future reference. Next slide, please. The handling of the sealed samples, once those are taken, either blood or urine, will be immediately refrigerated on site. They will be transferred to a refrigerator or a freezer, either there in the NCHA office at the event or in the main Fort Worth office, whichever is the case. Chain of custody is very important. Next slide, please. Samples will be sent to UC Davis Drug Testing Lab periodically. My understanding is these events take a couple of weeks, and the sampling will be done throughout the, presumably throughout the event. So, from a periodic standpoint, there'll be samples sent to the lab at Davis. Next slide, please. Very important note. I think everybody needs to understand that it brings the animal for testing here at these events. The lab does not get anything but a sample and a barcode with a number on it. They have no knowledge of who this sample comes from. They know the horse show, they know the date of the horse show, but the samples are only accompanied by a number. And that number, or those results, are sent to the NCHA office. So the medication testing forms that we showed earlier are kept separately, and those are sent on to the NCHA office once the testing is done. That is all from my section. Thank you.
Thank you, Dr. Martin, and also thank you, Dr. Stanley, for the excellent presentations and helping us with the webinar relative to the NCHA medication policy that is in place for 2012. I just want to reiterate that the tested events for 2012 will include the Eastern and Western National Championships for the purposes of introduction of testing to those events, but there will be no penalties at the Eastern or the Western championships imposed upon any infractions. However, the Triple Crown events in Fort Worth, which have gone through samplings through 2011, will have a penalty phase added to it, beginning with the Super Stakes. We know that we have not answered all of the questions. There will certainly be more discussion of this and a chance to have interactive communication during the convention. We will have further presentations and panel discussions at that time. And if you have more interest in this, we would certainly suggest that you join us in Nashville for the NCHA convention. Also, we are providing at the end of this webinar a email address that will go through the NCHA office, and you can email questions that you may have regarding the policy to the NCHA office, and our group through the medication subcommittee of the Animal Welfare Committee will take a look at those and try to respond as quickly as possible. We want to thank you for joining us on the webinar tonight as NCHA members and veterinarians that take care of our cutting horses. We appreciate your involvement in this most important policy. We look forward to seeing you at the next event. Good evening.